We're here with the Brother Side Podcast. This is not live. This is episode 17. Today we have Dr. Tom and Dr. Jordon Komp of Komp Chiropractic. What's up, fellas?
How's it going?
Good, good. Today we're drinking Vanilla Bean Blonde and Fairy Nectar. And how did you guys get into these drinks?
Fairy Nectar was, once we moved here to Omaha, was one of the first IPAs that was introduced to me, and I was kind of just getting into the craft beer scene, moving over from the domestic lagers that I kind of grew up on, and it took me a while to get my taste down for some of these IPAs. But I don't know, that first time I had one of these Fairy Nectars, I thought, man, that is a good one. That's one that whatever flavor profile it's supposed to be hits me right. So I've been drinking it for a couple years now, and that was pretty much it. It was really one of my first favorite IPAs that I had.
So will you drink domestic anymore, or are you just craft beer only?
Yeah.
You're a beer snob.
When you drink, he's one of those guys, you know,
like beer snob.
I will say I did some indoor golfing a couple weekends ago, and the fridge at this place only had Mick Ultra, and so I had a couple of those, but I was like, this is different, you know?
Yeah, it's like water.
It changes quite a bit. Yeah, still drank it. It went down just fine.
It's still beer.
Yeah.
Right?
I'm not turning it down.
Yeah.
Maybe a Miller Lite. I might turn down the Miller Lite.
Yeah. And we got Vanilla Bean. How'd you get hooked on that one?
I'm a Vanilla Bean virgin here. This is I've had so many patients talk about it.
Oh, okay.
I remember it was like a big deal, like when it went into cans.
Oh, yeah.
I had so many patients talk about it, so I'm like, you know what? I've never had it. It sounds good. I'm gonna try it. So here it is, first time I've tried it. I actually kind of like it.
Liking it?
So we're introducing the Vanilla Bean. I see.
All right.
This is it.
Vanilla Bean Cherry.
It is, and I'm a fan.
It's good. It's easy to drink.
I've heard so much good stuff about it. So
Yeah.
Good
It's
time to try it.
I am big into Fairy Nectar also.
How could
it's
you not
one of my
be?
favorite IPAs. I kind of, same like you, I was domestic, like Busch Light, Bud Light, Coors Light, you know.
Yeah.
Now, Coors Light now for quantity, but, you know, IPAs, I mean, I kind of got into,
figure.
yeah, that's right. Gotta keep this girlish thing going.
Before you guys got here, we were like, man, we have enough cups to play a flip cup if we wanted to.
I got that reach.
You guys have never played, right?
No.
Never.
So Flip Cup, but
Flip Cup, yeah.
what I have heard around here is a lot of people call it Tippy Cup.
Tippy Cup.
Tip cup, yeah.
I don't understand
gotta
that.
be a
Like,
Nebraska
I get in an
thing.
argument with our office manager. I'm like, you're literally flipping a cup. That's why it's called a flip cup. I'm like,
Yeah.
these Nebraskans with their tippy cup, I don't understand it.
We Googled it. It's definitely flippy.
Is it really?
Is it?
They said it could be both, but most of it's flippy.
Really?
When'd you guys move here? You're from Salina, Kansas?
Salina.
About 11 years ago.
Okay.
Where's Salina at in Kansas?
Straight south of York, Nebraska. So
Middle of the state.
north central Kansas.
Okay.
You hit York, Nebraska, go south for 2 hours, and it's
Gotcha.
around I-70.
Okay.
I-70
yeah.
and 81. Yeah.
It's a town of about 40,000, 50,000 now maybe. It's growing a little bit, but
Sure.
What brought you to Omaha then? How'd you get to Omaha?
I'll take this one.
This is my question. Pipe down over there. I got this.
Interjecting. So we grew up in Salina, and then we had made our way from playing sports at Kansas Wesleyan to finishing up our undergrad at University of Kansas. From there, going to get doctorates at Cleveland Chiropractic in Kansas City. So we were just Kansas this whole time. And when we were about ready to graduate and thinking, where could we open a clinic? Where could we, put some roots down? We would want to stay in Kansas City, but they were having a lot of problems at the time credentialing new doctors, meaning we wouldn't be able to be in network. Someone comes into the Blue Cross Blue Shield and says, hey, can I pay my copay? No, we're not in network. We thought, too big of a barrier. Where else could we go? And something about in chiropractic school, we made 3 or 4 really good friends, and 3 of them were Nebraska people, just these guys from Nebraska. I guess we meshed pretty well.
Kearney, Grand Island areas.
Yeah.
And
They sound nice.
And they had good dudes. Good guys.
Right.
And they said, why don't you try Omaha? We kind of liked the bigger city, coming from like that city of 40,000 to Kansas City of nearly a couple million. We liked the bigger city. We knew we didn't want to go back to too small again. So we just came up to Omaha a couple times and really liked what we saw out here and had heard good things about it. We didn't know for sure, but we just thought, you know what, Western Omaha looks really similar to where we had just been in like Johnson County area of Overland Park, Lenexa for the previous almost 5 years, and we thought it feels similar enough, comfortable enough.
Sure.
So we said, let's try it. That's pretty much it. It was like leap of faith after that. Looked
Just like,
decent.
hell with
Okay.
it. Omaha, here we come.
Pretty much had no friends, no family. We were just like, you know what, we're going to do it though. And it's been awesome. It's been a great 10
So are you
years.
twins?
No,
No.
15 months difference.
Okay. Who's older?
Damn near Irish twins.
Yeah.
Darn near.
I am.
Are
Can't
you?
tell he's got less hair.
Old
Yeah.
man over here. Old man.
You're
over
older?
Yeah.
You're
Yeah,
younger?
Yeah, you would have guessed differently.
No, that's not what I'm
Cool,
saying.
It's not all about the hair.
No, because I constantly get told that I'm probably the younger one.
Yeah, it's maturity.
Yeah,
That's what it is.
obviously there's like you're the elder statesman, clearly.
Yeah.
Yeah, it's obvious. Yeah, I'm 4 years older than he is. So yeah,
Darn near generation.
So you started the path down the chiropractic road, and then you followed him. I mean, you guys
Yeah,
have like the same bios
seriously.
here.
I started the
You
path.
would
and
think that, but no, he
Big brother.
actually
got
he
me
did decide on it first. I'll give him that.
Okay.
Okay, so you were convinced that you wanted that the chiropractic was the way of life. That that's what
We always knew that we wanted to be in the medical field of some sort. So we were at KU. We were going through the pre-med route, you know, and it was fine. But we had a couple friends that were in med school, and they just weren't like happy with the way things were going. And we're like, well, we could probably still deal with it and all that, but kind of took a step back. And we had always had chiropractic care growing up, but never really thought about it as a profession. And one day he's just like, I think I'm gonna be a chiropractor. I'm like, all right. I mean, that's
Is that trailblazer
Yeah.
the right word? I don't know.
That's the change. I was
Sounds
like, I was like, let me look into this. You know, like, okay, you get to work with your hands, you get to help people, be your own boss, make decent money.
Yep.
I was like, I'm in.
I'm in.
I was like,
Let's
I'm
do
joining.
this.
He's like, oh, okay, I guess.
Yeah, I guess
Good
anybody
talk.
can do it.
Real good talk. Okay.
So we decided on it from there and just went with it.
Did you go to school the same time then, even though you're the same, or 15
year
months
apart?
apart?
So we're a year apart in school, but because I played football one more year in college, when I transferred, I lost a year's worth of credits. So it sucked to lose that year's worth of credits, but it put me at the same level as him. So we were able to start chiropractic school and graduate at the same time. So it ended up working out in the long run. So we were able to open the business fresh out of chiropractic school.
Do you think we could run a business together? I mean, you guys are around each other all day.
Oh, constantly. That's got to be one of the number one questions. Like, how hard is it to run a business like with family,
It's actually
especially so close?
I mean, the podcast is enough for us.
Yeah.
That was a good
I
hour,
can't
man.
get out of here fast enough, to be
Yeah.
honest with you.
no, we get along real well, and when we don't, it's just two hits. You know, me hitting him and him hitting the floor. So
Oh!
See, that's why you stole my line.
no, we get along great.
I think we've been together so much over the years that you learn to pick your battles, who's better at what, who takes charge when, and it's worked out. It's worked out pretty well. I mean, sometimes you see how the sausage is made behind scenes, right? But very rarely do we ever have any sort of spat that carries over. It's just you just know what to do, what to say, when to say it. It works out really well. I know a lot of people can't do that. We've seen it happen with other people in the chiropractic field, even people you think you're going to work well together with, and then they just don't work out.
Yeah.
You know. So, but we're 10 years in, and it seems pretty easy to make it work. So
I would think that if things weren't going to work out, you would know by now.
You probably, yeah.
But so when something, comes to a head and you can't, it's not clear whose idea is better, you just settle with an arm wrestling match.
Oh, we
that's
definitely
what we do.
should settle
he's
that
way
way.
stronger. It's a weird upper body strength he's got.
Definitely should settle it that way.
We don't
Take to the golf
understand.
course.
No, that's
Yeah.
what we should start doing. Go to the golf course
Arm
and
wrestle's quicker.
settle this.
Yeah. Let's just solve this thing now. Yeah.
Let's
No.
not spend 3 hours figuring this out. Yeah.
Normally, we just let the office manager handle it. She's been with us for over 5 years, so we just like, Megan, what do we do here?
Right.
Do you guys divide and conquer so you have separate roles? I mean, you're both chiropractors, but as far as the business goes, does one of you kind of handle the finances? One of you handle the marketing? How does that work?
I
for you
do
guys?
way more of the administrative
Okay.
stuff, just running the business, handling all the behind the scenes, just what it comes along with like being the business owner. I tackled that when we first started up. It was kind of weird. Right after we got out of chiropractic school, I herniated a disc in my back, jumping on a trampoline with some nephews, and it was awful, and And what I ended up doing was a few months after that, I ended up having to have surgery, a discectomy at my lower lumbar area. And after you have a discectomy, you kind of have to take it easy for a couple months. And so while we were doing that, luckily enough, it was still like 4 months into us opening our practice, so we were pretty slow. And Tom was able to handle all the patients, and I just handled all the stuff that had still. There was a lot to do to open the business and to get it up and running, even in those first few months. And I just took all that on at the time. I wasn't treating patients, so I said, hey, I'll do all this kind of stuff and make sure we actually are running a officially licensed business and all that kind of stuff. And since I handled
part's
it,
important. I
guess.
Yeah.
there's like so much paperwork that goes into that kind of stuff to make sure that you're doing everything that's licensed and legal. And since I did it to begin with, I've kept that up for 10 years now, and I keep telling myself I'm going to make Tom take over at some point, but I don't want to teach him how to do it.
It's just easier.
I'm fine not doing it.
It's exactly. He'll use the line like, I don't think I'd be as good as you.
Yeah, right.
For sure.
You're just way better.
I've used that with my
right
wife
now.
when it comes to cooking. Exactly. Like, I would do it. I'm just not going to be as good.
Exactly.
Yeah.
I see right through him, but I don't do anything about
Great
it. It's
carryover
fine, I'll
there.
do it.
Yeah.
I don't know how to run this technology. Yeah, no. I hear you.
Same thing with my wife too.
So what would be your role, Tom, in the company? He's like, "Let me think
Normally
about
I
it."
see more patients and see, so I'm a little bit busier on the patient side of things, which is probably good because he does have more. Surprisingly, there's a lot of administrative stuff. Like even though our office manager handles a lot of it, there's still just a lot of stuff that you don't think about on a daily basis needs to get done with insurance and who knows, CE credits and all that type of stuff.
Yeah.
And just catching up on emails and things like that. I'm notoriously bad at that, but
Sure.
he does a great job. You're so good at it, and you just better keep doing it.
It's not working on me.
The truth comes out.
So going back to your early days, how did you guys end up at the same college going to, did you have scholarships to go play sports at Kansas Wesleyan?
Yeah, so Tom got his scholarship to play football, and I got my scholarship to play baseball. And I think there was that, Kansas Wesleyan is in Salina, from where we are
that makes
from.
sense. Okay.
And so there's like that comfort level of you want to go to college, and we wanted to play sports, and there was that comfort level of being not too far away from home. We were like 15 minutes from home. And so it just seemed like a good fit for us because we were good athletes, but not the best athletes. It wasn't like we were going D1 anywhere, but we wanted to keep
Not with
playing.
that
So
attitude.
it's just, it was a
Really
great
held me back.
opportunity. It's just that it ended up being that probably the best opportunity for us at that time was to stay local like that. And that's what it happened to be for both of us. And once you're there together, it just seemed like a natural, transfer when we figured we were done playing sports. Like, well, we're both kind of pre-med kind of people. Let's go to KU where they have the med school. Because at that time we were still just on the medical school route. We hadn't decided on chiropractic yet. And then of course a few years later I decided chiropractic school and big brother here decides to follow. So that's kind of how it happened. I think there's always been a closeness with us anyway. So we always could kind of envision staying together or opening up a clinic together. It didn't sound far-fetched at all to us, so we just kind of kept going with it, and it worked. So
Do you have other siblings?
We got a younger brother.
Younger brother? Does he feel ostracized?
He's also a chiropractor.
he should.
Yes.
So
Of
We'll
course
get
he
into
is.
it.
Why wouldn't he be?
And I
Yeah.
heard one of your wives is a chiropractor.
mine. Yeah, there's a lot of chiropractors in
So-
the family.
Did you two meet at chiropractic school or med school then?
We met first day at chiropractic school.
Yeah.
Yeah.
Okay.
What a
We were
love
just-
story.
Yeah,
Just
break it down for
classic
us.
love story.
Break it
She
down
had a
for us.
boyfriend when we got there, and I said, nope, he's got to go.
Yeah, clearly I'm better.
That's right.
Look at me.
There's a Nicholas Sparks book out there.
That's
please.
right.
What's nice is you can't get her point of view on this, so you got to trust Tom. So
Yeah.
Have you ever thought about combining forces?
No. That's a little bit too much together time. I prefer to stay married, so
Yeah.
it's when you're there at the office and then you come home. It's too. I think it'd just be too much together time.
Right.
Like, it's nice to have a little separation and then come home at night.
Do you compete on businesses on who's performing better? Do you guys talk shit like that?
She works for a practice that's down the street, and they are more high volume.
Okay.
And so it's a lot more turnover and things like that. So they see more than we do.
We don't want to compare with them. Let's put it that way.
Oh, this is a shout out. What's the name of her business?
I can't throw it out there.
This is about us right now.
But
they would beat us in most metrics, I would say. So
they've been in practice for about a decade longer than us.
Okay.
they kick
Probably
ass.
matters.
Yeah. So but they have a good practice. She likes it out there. It's and she's happy. So we're happy to have her do her thing, and it's nice too. She's not an owner, so she goes in, she treats, and she leaves. There's no hangover left over or dealing with other side outside her time.
It's more a 9 to 5 job for her.
Yeah, and it works out.
You guys
for our
don't leave
kids
it
and everything.
in essence.
And how about your brother? He practices in Kansas?
Yeah,
He's in Kansas City. Yep.
You said he's younger,
5 years younger.
and did he do it because you guys did it? Mm-hmm. Yeah.
So back to that trailblazer
Yeah.
we talked about. Yeah.
So he saw how much we loved it, and he's like, you know what? I want to do something cool like that. And
I didn't think he would. I did not think he would.
Didn't think
would
he was
follow
smart enough.
us.
Or?
Yeah, basically. Are you
Now's your
listening,
time to
Ethan?
say it.
Yeah.
it's true.
No, since he was always behind us, 5 years behind Tom, 4 years behind me. So we graduated high school, and Tom graduated, and the next year I graduated high school, and then Ethan came up into freshman year, like right after we were gone. So he was never in high
That's
school
how we
with
were.
us.
I was graduating.
College was the same way. We went to college, and right when we were done with college, he started college. So he like never really had us there around. So he kind of went through all of high school without either of us around the house.
Sure.
He kind of had to like be his own person, developed his own identity that was.
I'm starting to feel bad for him.
Yeah.
outside of-
There's
outside
a
of
tear
us.
welling up here.
Ethan.
We refer to him as the
Shout out to
Cooper
Ethan.
Manning.
Yeah.
No one knows
lesser
about him.
Manning?
Like,
Cooper Manning of the Manning brothers.
he hates when we call him Cooper Manning.
Yeah.
But it was
Hey,
just
Coop,
because
what's up, bud?
Yeah, he hates
it was because of that he had his own ideas, his own identity, and he had some different interests than what we did. We kind of act like twins sometimes, and Ethan was outside of that. So he just had some nice interests. He went to Washburn University in Topeka, which is a nice university, and he was part of like some cool clubs there. And I just didn't really see him necessarily going like the pre-med, the chiropractic route. But I think the more he saw us really enjoying it and learning and being enthusiastic, he just kind of thought, oh, that does sound pretty cool too. So.
Did he go to Kansas Wesleyan also?
No,
for
he just
sports?
went straight to Washburn.
Okay.
For sports.
Yeah. Did he?
With the same, yeah.
Did he? Is his wife named Erin?
Megan.
Megan.
Yeah, let's get that on the table. So Aaron.
I have an Aaron.
Yeah, oddball out here.
Yeah,
Come on.
I'm odd man out. I got to find me an Aaron.
He actually set us up, me and my wife up.
He had the right idea then.
Yeah.
He just didn't fall through
I did.
himself.
He didn't understand that he also had to get an Aaron. Yes. But so he did not go to. Was he not an athlete like you guys?
Not.
How big a high school?
He was
did
a
you
High
guys
school
go
he
to?
was, but not enough
He
for
probably
the
could
next.
have done something at like the small college level like we did. I just think he didn't have quite the passion or the love for it like we did. But he probably could have done something somewhere.
Was your high school big? No.
It's tiny.
Was it one of those that you play every sport year round?
If you're an athlete, you played every sport,
So
if you wanted to.
I just picture like, it's basketball season. You guys are rolling into the next small town. And, oh God, here come the Komp brothers. God.
Yeah.
Yeah, I don't think so.
No.
It sounds good, but
We were good, but we weren't dominant by any means. Like,
God,
I
the
don't
Komp
know.
brothers.
What position did you play in football?
In high school, I was a middle linebacker and wide receiver, and then in college, I played wide receiver.
Really?
So
Okay, you got some hands on you.
did not anymore. Those things are gone.
What
but-
happened?
Yeah,
What are you, 6'4"?
6'4".
Okay.
Yeah, I used to be pretty
That's a
pretty
big
quick.
target.
Yeah, I used to run down the field and just threw it up to me. Pretty good little athlete back in the day, but
You got those
Settle.
LeBron hops, right?
Now
Just
I'm
throw
all-
it in a 10-foot vicinity and you'll go get it.
now I'm all old and slow, but
he drops a lot of things at the office. I'll toss him anything. He drops it 90% of the time.
You're just like, what
unreal.
happened?
It's
You were looking at me.
exactly.
He hits his hands every time. Still drops it.
Lies.
What was your baseball position?
Mainly shortstop in high school, and then I got to college, and they had a senior shortstop already playing. So they said, "Hey, you're not going to play this year. Why don't we turn you into a pitcher in the meantime?" Because I could throw hard, and I was like, "Yeah, but I've never really pitched before." So they'd coached me up a little bit, taught me to pitch a little bit. I don't know that I loved being a pitcher. It wasn't what I really wanted to do. I wanted to play shortstop.
Yeah.
But
Shortstop's awesome.
It was shortstop. That's where all the action is. You know, that's why I loved it.
Yeah.
But yeah, I got to pitch in quite a few games my freshman year. It was fun. I wish I could have been better at it. They try to teach you how to throw a curveball. I'm just like, how do you move your arm like this?
Yeah.
I got a few of them, but man, I beamed a couple people too. That ball was supposed to curve and it didn't.
Like, oh God, I'm about to get hit. Did you guys become KU athletic fans then because you went there, or were you already before you went there?
We grew up being big KU basketball fans.
Yeah,
So.
You have to be,
not
don't
KU
you?
football fans.
Rock Chalk Jayhawk.
It's tough. I mean, we are, but it's hard to be a fan of them for. I mean,
I watched
the
every
football
game
team.
this past season.
What
Every
is
football
Rock
game.
Chalk Jayhawk?
Yeah, what does that even mean? I don't even know what that means.
Oh,
I
it's like
know
the-
the chant, but
It's like the
yeah.
dumbest thing.
It's a what?
It's like the dumbest thing. I guess if you look into the lore of it, the KU campus is built like on a limestone bluff type of area, which is like a chalky rock. So I don't know when they came up with this chant. People were weird like 100 years ago.
yeah,
Know?
right. yeah.
They're kind of like, what can we chant? Well, I guess we'll say Rock Chalk Jayhawk. I don't know, but that really is like one of the rumors of how it started.
Wow.
Okay.
I thought there was
never
going to be a
heard that.
way better story.
You would
than that.
think, yeah.
Yeah.
Nope.
Nope.
No,
Not that
that's
we
it.
know of,
It's
anyways.
on a chalky rock.
Let's
Damn
chant
it.
on a rock.
Yeah.
We could look into it. Maybe there's a better rumor out there now. Or
It
a
rhymes.
story
I
of how
mean,
it
It
started.
does rhyme.
what else can you ask for?
That is one of the benefits.
That's the main point.
You guys are having a bad basketball season, aren't you?
It's down.
Down.
It's down.
It's still decent.
They're
like,
still one of the better teams. but
I mean,
down.
it's hurts my
yeah.
heart a little bit.
Went out of the
yeah.
rankings a couple weeks ago, which broke the I think the all-time NCAA streak for a number of weeks in a row ranked. So I mean, that
Yeah.
was pretty good.
Yeah.
Yeah. not to brag or anything.
That was decent.
Yeah,
but
that was a
went out of the
decent-
rankings, won a few games, came back in, ranked number 17th. Lost in overtime to Texas earlier this week. Probably going to lose this weekend to Baylor when they come to our place.
Yeah,
I would
probably.
guess enter March Madness probably has like a 5 seed. I'm thinking win a game then lose after that. That seems about the Sweet 16 for KU this year. I feel like.
Would be
Be a
a
win.
win.
Yeah, we're
it
celebrating
would.
for that. They just don't have they lost 2 All-Americans from last year. And
Oh, well, I am
struggle a little
slowly converting to be like a Nebraska football fan, though.
Really?
Yeah, it's
Of all time,
it's
now
hard.
is the time. That's surprising.
catch 'em by the low.
Well,
We're
it's because-
pushing people away by the thousands.
well. I've learned that if Nebraska doesn't win Monday morning when patients roll in, it's pretty somber in there, So like I like it better.
Real quiet.
Yeah, I like it. They come in after a win a lot more energetic. So
Yeah.
Yeah. There you go.
Gosh, it's been tough to be a Nebraska athletics fan, unless you're into wrestling or women's volleyball, which they're good. But
how about us? We're Jayhawk football and Husker football fans now. I mean, that's terrible.
yeah,
It's like
You got to find new teams.
like Tom said,
Yeah, no
people will
kidding.
come in on Monday mornings after a loss on Saturday, and they'll be like, "Oh, did you watch the game?" And they complain about watching 3 hours of bad football. I say, "Hey, I watched the Jayhawks and the Huskers. I watched like almost 7 hours of bad football.
Yeah.
You think that was fun?
yeah, Nebraska used to have one of the longest streaks over Kansas. That used to be one of the longest.
It was like 27.
it was a long.
Yeah,
time.
it was a long
I
time.
remember that.
Yeah, I used to enjoy that until the mid 2000s. I can't remember that. Riesling?
Riesing.
Yeah,
Riesing.
Riesling. That's right. Yeah,
It was like it was like a basketball score.
Yeah,
Crushed you guys, and it's like the one time in 30 years, though, so we can't talk
that
too
was
much on
so
it.
painful.
Yeah.
They scored 70 points in the
It
game.
was like 77 or
Yeah.
something, like 77 to
I'm like, this
33
is
or
It's a
Kansas.
basketball score.
Yeah,
it was bad.
those were the calendar.
That was 1 out of 30. So
Yeah,
I think the Jayhawks earned that one, right?
they did. That's
We almost had your guys' number. I'm a Creighton basketball fan. We almost
Yeah.
had you at the beginning of the season.
Yeah,
Almost
probably
did.
would beat KU now.
I think
I don't
so.
know.
Probably.
It'd be close.
Creighton's dropped some head scratchers this year.
They've looked.
They've really good against tier 1, tier 2 teams, and then they've lost 3 times to tier 3 or worse teams.
Yeah.
So I mean, they're just really all over the place.
Well, when you don't play very good defense, that's
Yeah.
it's you can lose any game almost,
Yeah,
and that's what
yeah.
Creighton does. But when they play at their highest level, man, they're a top 5 team.
They
Creighton
are.
looks great when they are
When
playing
they're
at a high
that way.
level.
Yeah.
Live and
As a
die by
KU
the 3.
As
yeah.
a KU fan, I don't want to play them in the tournament. I'll tell you that much, though.
Yeah.
That'd be fun though.
It would be,
That
but it'd be. I don't want to play you guys because you guys get hot and it's just
You can't stop
You can't
them.
stop them.
yeah.
Well, Mitch Ballock's shooting from like 20 feet beyond the 3-point line. I mean, it's like,
That's a Kansas
unreal.
kid. You're welcome.
Yeah,
You're welcome, Creighton.
Kansas Gatorade Player of the Year.
where's he
Yeah.
out of? Some with
Is it
an
like
E.
Emporia, I think.
Emporia.
Yeah,
that's
Emporia. Yeah.
Yeah.
Let's talk Jordan.
What's up?
We hear that you're a big Ryan Reynolds fan. We're gonna switch teams here. I didn't have a good transition.
Mari's like, hey, I sent your profile over. This is what I said. I'm like, why would you say that?
So, wait, why? Why wouldn't she
like
say that?
So that's like,
It's the joke in our office.
that's how I compare myself.
Deadpool all over
I
his room.
compare myself to The Rock. I got you.
Right? You
I'm
know,
with you.
I said, hey, I've done like 20 workouts in the last 3 weeks. Like I'm now at 67% of Ryan Reynolds. Like that's the goal to get to Ryan Reynolds. I'm nowhere close, but that's always the goal. And we talk about that surprisingly a lot. So
Yeah.
It's a weekly total, like, I'm down to like 48% Ryan Reynolds this week.
I had Culver's twice. What are you gonna do?
The measurement of your
right.
body's off Ryan Reynolds. That's hilarious.
But he's
That's
a cool
high
dude.
bar.
You know, he's like a really cool guy.
Yeah.
He's that sarcasm that I think everyone loves from Deadpool or like the Van Wilder days. You know?
Yeah.
So he's always like a funny guy. Plus, you know, it was Blade. That was the Blade movie where he just got jacked, and I was
Oh,
like,
yeah.
well,
That's when he turned.
yoked
Yeah.
if I'm gonna go after a certain body type, that's what we should strive for, right?
Yeah.
You know, he was huge
Or The
in that
Rock.
one.
Or The Rock.
The Rock.
Yeah,
How
The
can
Rock.
you go wrong with the
Too
Rock?
big?
Yeah.
Yeah,
You
that's
can't, you know, you can't
I'm
fit
working
through
my way
doorways.
there. That's right. If you couldn't tell.
A little ways to go.
Yeah. Little ways to go.
So Tom, who's your celebrity crush?
I'm gonna stick with
I'm not even ashamed. of it.
Yeah.
with a
You know what?
female.
If Ryan Reynolds would probably be in my top 5 guys.
Yeah.
Go for
Honestly,
sure.
Would you?
to make
Top
it.
five?
Yeah, my would you?
Oh, we're spiraling here.
Yeah, oh, yeah.
We're going down quick.
Yeah, he's good, really good looking, super rich, funny. What else is there?
It's like hard to go wrong.
Yeah,
Hot wife.
great hair.
Yeah, he's
You know?
Great hair.
Yeah.
It's all about gray hair.
Yeah, obviously I have a thing for
Hey, you're
hair.
like Jason Statham though.
Yeah.
Just a lesser version.
He's going for the Rock
I need
look.
Yeah, I need an accent if you're going to compare me to Statham.
You need a lot to be Statham or The Rock.
I don't know, not that much. We can get into that another time.
Yeah.
Like,
Sure.
like what percentage are you here?
Yeah, I upper 70s,
Obviously.
obviously.
That's a good question. Like, what's your beard look like when you grow it out?
I don't know. Since
never
I've been a
grow it out.
firefighter, I haven't been able to grow it out.
Yeah.
Like so the way our schedule works, I'm on my 6 days off.
Yeah.
And so that's why I haven't shaved, and I refuse to until I have to.
Yeah.
So when I retire someday, way down the road, I will grow that beard out to find out what I can do. But we can't grow beards. We're not allowed.
I'm
Mask doesn't fit.
Yep, mask doesn't seal right.
It doesn't seal. That's dangerous.
Yes.
really
I-
worried.
Apparently that's important.
my hair is going pretty quickly too, but I can't really grow up. I mean, this is most as I do because it just gets nasty if I let it grow
kinda
out. I mean,
patchy.
it's thin, patchy. A lot of blonde hairs. There's actually a lot of hair, guys. It's just blonde.
I swear it's there. You just can't see it. It's
But
kind
like, what am I supposed to do if I go full bald and I can't grow a beard? That's not a good
yeah,
look,
it's
you
not-
know.
Yeah,
You
I
just-
hear
It's a
This is
testosterone
messed
issue
up.
from
I
what
think
I
you just
hear.
tell people you have cancer.
Yeah, I'm hanging on by a thread over here.
Don't do that. That is a terrible advice. Terrible advice. Just take a
Don't
break.
do it. Let's cut that out. No. On that note, yeah, we're going to take a quick break and thank our sponsor.
Are you committing yourself to exercising in 2021? We can't help you keep your head out of the Cheetos bag, but we can help fix up your exercise equipment. Don't let your fitness equipment be the reason you don't hit your goals. Call Fitness Machine Technicians today. Fitness Machine Technicians repair and maintain all makes and models of fitness equipment. Some of our clients include hotels, apartments, gyms, corporate companies, assisted living, physical therapy, and let's not forget the homeowners. Fitness Machine Technicians keep your equipment fit to keep you fit. Give us a call at 402-871-4735.
We're back with the Brothers Side Podcast. Brothers Pearson and Brothers Komp with Komp Chiropractic. We got two sets of brothers.
He was. I think, you're jonesing to say that at some point.
Was that?
Brothers, I don't know. I just feel like
Maybe I was.
That was deep in your.
Where were we at? We were just talking about lack of hair.
Yeah, we were. We're comparing ourselves to our doppelgangers, if you will, Ryan Reynolds and The Rock. And
Doppelgangers.
Doppelganger,
Yeah,
or stunt double. You know,
I'm
I've
not
been
going to
asked.
disagree with you, you know.
Yeah.
It's a good thing this is a podcast, not on television.
Yeah, right. It is on YouTube.
It is on YouTube.
Okay,
Yes,
well.
they will see
But
it.
most people listen to the
Wow.
podcast. Yeah. So
You tell us that now?
we like to embellish.
I got you.
Let's get into the chiropractic realm here. I'm going to start off with one question that I think everybody wants to know. Is the motto cracking necks and cashing checks? Is that a thing in the chiropractic world?
You ride or die with that phrase. That's it. I say it all the time.
It's been known.
Cracking necks and cashing
You're
checks.
just like,
that's what we do.
You're adjusted. Give me your money. No.
Yeah, I've said that no less than 1,000 times.
Yeah.
Usually just trying to, you try to make it funny and get a joke out of, or make people laugh. But yeah, I've said that a lot.
Well, it's funny because the first time I heard about it, I'm pretty sure I was at a center sphere deal, and it wasn't even a chiropractor that came up with it. And they're just like, I'd walk in, they're like, and they said that phrase. I'm like, I've never heard of that, but I'm using it from now on.
Yeah, always.
You know what I think would be bold if you just put that underneath Komp Chiropractic on your billboard outside.
That is bold.
You try to get
those guys, man.
Yeah,
they are bold.
that's right out front. Hey,
You're transparent.
We are who we are.
It is. We try to minimize the old money issue.
Yeah, I can understand that, but I like the phrase.
It's catchy.
All right, on a lighter note, one of the questions I'd like to ask is chiropractic care in kids, babies. Do you guys handle both of those?
Yeah.
It's recommended. I think a lot of people fear, kids getting adjusted and having potential issues down the road. And maybe you guys can debunk that myth.
So we starting with the pregnancy, we see a ton of pregnant women because as they get more, they get larger, as they go heavy. That's not the way we would put it, but
Round.
yeah, in general. But their body starts carrying weight a little bit differently. It puts pressure on the joints, and we do a ton with the pregnant women. And then after that, as the body tightens back up and their hormones change, everything like that, it's nice to keep them. But then we get into the babies and kids, and it's super safe. It's not like, it's not like the ring dinger you see on the YouTube channels. It's very light.
I have not watched much chiropractic YouTube.
Some people come in, that's like, that's
it's-
all they've seen, and there's like,
really?
I've got to have
A
this.
Houston chiropractor racks up like millions of views.
Is this the guy who can crack you 100 different ways?
He does the move called the ring dinger.
I don't want any part of that.
That sounds.
You'll have to, yeah.
But yeah, except it sounds funny until you get a patient come in and be like, hey, do you do the ring dinger here? No, we don't.
It's pretty
Go watch
aggressive.
YouTube
It's
if you
pretty
want.
aggressive. But no, we do see a lot of babies and a lot of kids. It's very gentle. It helps a ton with constipation, colicky babies. It really just depends on what they're going on. Sometimes if they're nursing on one side, they have a favorite side, they'll get a little torticollis on one side, and we help release that and helps them nurse better. It's all very gentle, pretty nice. And then as the kids grow, as their spine's developing, they take falls and tumbles as a kid should, but we just kind of minimize small problems from turning into bigger problems. It doesn't take too much. And just a little bit here and there. It's very gentle, very safe, and they respond really, really well to it.
Our babies are so limber. I wouldn't think that they would need to be cracked, but I've heard of babies being.
It's adjusted, not cracked. Adjusted.
Sorry, adjusted.
We go with anything.
Yeah, it's fine.
Sorry, adjusted.
Yeah, we usually say if you have a spine, then you might need adjusted. With babies, because people really don't know. They'll come in after being a patient for a year, and they'll say oh wait, do you adjust children? Well, no. Yeah, do they have spines?
Spine?
Right, that's kind of what you say. Do they have a spine? Do they maybe need an adjustment? Kids are easier. They're so much more limber and flexible that they can take a small trauma and recover from that pretty quickly. Whereas adults, as you age a little bit, that spine and those muscles they're not quite as limber anymore, and it can be a big deal. But yeah, children, if they jump off something or fall too much or have too much trauma, they can definitely get those same misalignments that start causing problems. And you'll know too, because how often do you hear several days in a row a child say oh, my neck hurts? It doesn't happen very often. So when you hear it, that should perk you up a little bit. Oh, they might have a legit problem. They're not making this stuff up. The kids don't make that up. They point to the same spot in their neck or back, say, oh, this hurts for a few days in a row. Well, maybe get them checked out for a misalignment.
Do you feel parents are hesitant the first time they come in?
Sometimes.
I haven't really come across it. I mean, they're questioning. They're just oh, do you do kids? And then once they see it and they have it, I mean, it's they're pretty happy with it. Obviously, the great thing about kids is you get great results. Like I said, like Dr. Jordon said, it's very rare that you get those kids in. We maintain them just like the adults every couple of months, preventing small problems, turning big ones, but they heal so much quicker. It makes us look good.
Yeah. Oh, yeah.
I was I love treating kids
Miracle
because,
workers.
these hands,
If you even knew.
That's right. But they make us look good, and it's nice because it helps them, it helps us. It's a win-win for them and us.
You reiterate to the parent, like, yeah, it can be very gentle. And we have a tool that we use called an activator sometimes that if we don't want to put like hands on and do a manual adjustment, then you use this little activator, kind of a clicker tool that you put on the spine and do the adjustment that way. And that way you're not really applying like a thrust at all with your hands. So it can be as gentle as we want it to be or need it to be. And that usually really helps any sort of fear or hesitation that a parent might have. Just be like, yeah, we don't have to push much at all. We're just going to get that adjustment or to get that misalignment realigned and be good to go.
So for kids, do any of the adjusting help with potty training? Because my goodness, my kid, I need your help. I'd bring this up on every podcast. Is there anything you do for my 4-year-old, for the love of God?
I'm a baseball coach.
Yeah.
You're on your own for that one.
Yeah, you might be on your own for that one. Dude.
Oh my gosh.
It can be frustrating.
Yeah. Oh.
It can be frustrating.
Still going through it. Yeah.
My 2 girls, ship shape, potty trained in like a weekend, done deal.
That's how my
Easy.
first one was.
Oh, yeah.
My first son was that. My second son, I mean, we've been at it for over a year and a half.
Stubborn. It's frustrating.
Yeah.
Yeah.
He's been no issues. Been great at that forever, but
Yeah.
number 2, not so good.
Likes that pull up on?
Well,
What
and
is
you
it?
know,
Yeah.
let's just say we've tried everything.
He likes to mess with his dad a little bit.
yeah.
Like, because he just had his,
yeah,
just became a parent, and he's like, she's gonna be potty trained before your second one. And it's like,
Give it a couple
that's
years.
my
We'll
goal.
see.
That's my goal.
And part of me is like, ha, but I'm like, oh my God, that's
son of a
possible.
gun.
Like, he's gonna be 8. Like,
Awful.
yes.
They figured out eventually.
Yeah, I don't think that's a chiropractic issue.
Dang it. That's a could have lied to me.
issue.
Yeah. All right. It's Aaron's fault.
We can, but it's like
Great question.
Yeah.
it's like triple the copay,
Right. Okay.
So, a lot of people talk about chiropractic care versus physical therapy.
Yeah.
I think there's a big difference there. Some people I've heard in past, like, chiropractic care works and physical therapy doesn't, vice versa. What's your take? Do you guys partner up or you?
You can. Both work. I mean, that's why there's so many physical therapists or so many chiropractors. Yeah, they both work. We enjoy working alongside a physical therapist a lot of the time. If we can, there's no qualms with that. I think we do things just enough differently that you get benefit from both sides. We're not going to spend a ton of time rehabbing. If someone's post-surgical on a knee replacement, hip replacement, we're not going to, that's not us. Don't come to Komp Chiropractic for post-surgical rehab. That's just, we don't do it. Go somewhere else. So.
There's some crossover between us and PT and chiropractic, and which is great because it's stuff that works. We do a lot of muscle work, active release technique therapy, muscle therapies that help break tissue down, rehabilitate. But where PT excels is their rehab, and like Dr. Jordan said, post-surgical, we're not the ones to come to. We have the training and the background, but we're not. But we better specialize in other things.
Sure.
Likewise, but if someone's got an acute low back injury, we're probably the better care than physical therapy. We each have our strengths and weaknesses, and we love working side by side with PTs. We have several in the area that we work pretty closely with, as well as MDs. So it's nice to have those professional relationships that work really well for us.
That makes sense. What are some of your specialties in chiropractic care?
For chiropractic, we're great at your neck pain, your headaches, mid-back pain, low back pain, kind of the standards that you think of, sciatica. The way we are a little bit different than some other chiropractors is we do spend a lot of time on like myofascial release, which is for muscular, tendinous, ligamentous problems that might have their own scar tissue or problems with that causing their own problems. And that can be separate from just a misalignment of your spine. This could be in a foot, a knee, an elbow, a shoulder. We have extra training to work on those that other people don't have sometimes. So people can come to us with tendinitis problems or cumulative trauma injuries, repetitive trauma injuries, and we're pretty adept at getting those better. And that's just we can treat patients and we don't even do adjustments on some of them. We just work on their muscles and soft tissues, and so that sets us apart a little bit, and that's pretty cool. But the standard chiropractic stuff we're great at, along with some extra things.
We originally got that extra certification, allows us to work on the muscles, tendons, ligaments, all of that, because we thought, hey, we're going to work on athletes. We're athletes, and we want to work on athletes.
Sure.
We get into practice, and there's athletes there, but you need to be a family practice to be successful. You can't focus on.
There's not enough athletes.
There's not enough athletes. So then, turns out, the muscle techniques that we're certified in work just as well, if not better, on your regular everyday patients that have, hey, I've been at a computer for 8 hours every day for my life, and you've got this horrible knot in your shoulder and back and neck, and it works fantastic for that. So it's a good crossover. So it worked out for not only just your athletes, but just your everyday persons. It works even better.
Anything for plantar fasciitis?
Yeah.
Yeah, a few things.
I had to get surgery because I thought I'd tried everything.
It's a bad one.
I went to physical therapy. I got shots. I did, the ball rolling. Any way I could stretch it. I was sleeping at night with these socks that like bend your toes back to stretch out
just
your
to
calves.
Stretch it, yeah.
Oh, it was very uncomfortable. I'd start
Especially
cramping in the
sleep.
middle of the night. But I had to get
That's
surgery on
That's
both.
terrible. How are you now?
I'm probably about 85%.
Yeah.
That's good.
That was a couple of years ago, but my dumbass was trying to meet was trying to meet a deductible in December, and he's like, "Well, we're just going to do the one for now." And I was like, "Well, I've already met the deductible. Let's just do both."
We're doing both.
It's like, how do you
Not walk at all.
That's out.
Yeah,
Let's save a couple
wasn't well
dollars.
thought out.
You better have a really good wife. Take care of you for the next few weeks.
Yeah, that's about how it was, but that's good. So you guys can help with that.
We have a few
Yeah,
techniques,
sometimes.
like the muscle technique that we were talking about, myofascial release. I'm also certified in using needles, so I can use needles to go in there and break that tissue up. And
Acupuncture.
acupuncture, and there's a different type of dry needling with it, so you can do the combination and figure out what's best. There's multiple things you can try, and that's where our relationships with other doctors come in handy, because we work really well with a lot of those things, but sometimes it is beyond what we're capable of healing, and it's nice to have doctors refer on to that you trust, that you can send your patients to. So.
Circle of friends.
Yeah, kind
Well,
of.
you can't fix everything every time.
Yeah, I
you
mean-
gotta. And if you're not gonna, if you can't help somebody, you gotta know pretty quickly who's the next best person to help them.
Right.
So it's nice to have that. It took us some years to develop those relationships, but I think we've got some good people in the area now that we can refer to.
For sure.
That you met through networking.
Oh, jeez.
And through trial and error.
The center sphere.
No, I'm not doing that.
Are there any real dangers with chiropractic care that, like, you're ever concerned about when you're working with a
Ring
patient?
dinger, probably.
Yeah.
There it is.
No, not really.
Okay.
Not really. I mean, you were trained so much to do spinal adjustments. It's gentle, it's effective, it's if you're doing it the right way and taking it seriously, yeah, it's incredibly rare to have any sort of injury. People can be sore after an adjustment.
Yeah.
They were sore coming in, so
Right.
sometimes you re-inflame an area that was already inflamed a little bit, but no, there's rarely any side effects of chiropractic care or problems that can. The worst usually that we say can happen is it doesn't work the way we want, and we don't get the results we want, and we refer you to the next person.
What would you say is the number one fear? I think from people I know and friends, it's like, what if they break my neck? No, seriously though.
Yeah.
No, for sure.
Why not go 1,000%?
It's not
hear it.
Steven
Yeah.
Seagal and Under Siege, just snapping necks. Like, it's
You
hard.
get that a lot, yeah.
It would be
It's-
hard to
why
do
It's
that.
cracking necks, not snapping necks.
Yeah.
This is why I don't look like The Rock, because I could easily look like him, but for the purposes of chiropractic care, it's
What are
it's not
your
conducive.
secrets?
It's just not conducive. No, we do get that question from people sometimes. They're very nervous about their neck adjustments. At times.
It's crazy. It's almost, I'm not saying impossible, but it's harder than you would think to actually injure somebody significantly. Like the force that we're putting into someone's neck is very, very minimal, across your body. It's, like I said, it's just not enough to cause any tissue damage, but people have that in their mind. They get those Steven Seagals and
Yeah.
how easy it is to it's almost impossible to hurt anybody like that.
It makes it look so easy, though.
It does.
Him and Chuck Norris, they are so good at that, Man.
But we do get that.
I feel like if I just look, one way or the other too fast, I could stay on my own neck.
That's it.
But you get those people that are nervous and treat them for the first time, and there's like, that's it. Like that felt amazing. Like most people end up loving it,
Oh, it's great.
but you do get those people that are a little bit timid up front.
Yeah,
and
sure.
You just do the best you can, and we have some patients that are honestly they want to be treated everywhere else, but they don't want their neck, and that's their prerogative. We're not going to force anybody into something they don't want. Like we might recommendation, like if it gets really bad, I might, see if we can do a different technique about it where there's no snapping or anything like that, obviously. But we're not going to do anything that someone's not comfortable with.
That's the biggest concern for sure, is just the neck adjustments for
yeah.
people. Yeah.
And it's super safe. Yeah.
How do you feel about people that are making their quote unquote own adjustments? So if I'm at home and sometimes you're in a position
Alex will
like, "Gosh, I
ask
just
me to walk on his back sometimes.
not walk.
Unbelievable.
Push down.
push down on his back, crack his back.
Yeah,
And I was like,
I just have this pressure, or like I'll lean up against something, or my wife's like, is that healthy?
Don't
ever
do that.
ever do that.
No,
it's not.
It's not a
really
big deal.
Take anything away from this podcast.
Don't ever do that again. Sit there in misery.
It's not a big deal. Usually what happens is the segments that are already moving freely, you're just getting those to move, and there's little joints, and they just release gas, and you get that popping noise. And so the segments that are freely moving, they're already moving. You're just getting those to move a little bit more. The segments that are actually stuck, like not moving properly, you're probably not going to get those to move by having your friend or whatever. That's what we're designed to do, is find those and get those moving again.
Sure.
But it does feel good because
It's temporary relief.
it releases endorphins.
Yeah.
You get those little pops, they're called cavitations, you release those, and it releases endorphins, and you feel good for a while.
Yeah.
But then what happens, you get like a couple out here like, oh, can you do that again?
Yeah. Yeah.
Whereas with us, we're finding the ones that are actually stuck, not moving, or dysfunctional, and we get those to move, and but yeah, I know you're not hurting anything by doing it.
We would ask people, do be careful on your own. Like there is an art to adjusting joints, and you got to know what you're doing a little bit. There's a small chance you could injure somebody while unprofessionally doing it, but yeah, people self-adjust all the time, and there's rarely an injury involved with it. If some people get in the habit of that neck adjustment, they sit at the office all day long, and they're rotating that neck around themselves, and they don't even know they're doing it. It's almost a habit. They're doing it 20 times an hour. That does create like an instability of their neck. It causes
because you're constantly
doing it,
overstretching,
and it actually it makes the brain tell those muscles to tighten up, and then they feel muscle tightness, and they think, oh, I'll just twist my neck around again, and they'll get a little pop from it. But really what they're doing is creating too much movement in that one spot of their neck.
It's hypermobility.
Yeah, it's called hypermobility. And when you do that, the brain tells the muscles, hey, there's too much movement in that one spot of your neck. Hey, muscles, tighten up right there. What happens? The muscles tighten up. People feel that muscle tightness, and they think, I'm so tight, I'll adjust again. So actually, you don't need to adjust that anymore, but it gives you that 5 minutes of relief.
It's a negative feedback cycle.
So that's what we tell people. Don't be the person who's doing it 20 times an hour. You stretch in the morning, and you lean back against your chair, and you crack your back a little bit a couple times a day. That's no big deal.
No.
That's about it.
Yeah.
Do you when you see people on the street that are hunched over, are you just like, oh, I want to get my hands on
I just
them?
want to adjust it.
I do.
Yeah.
Like the way people walk, sometimes you
Yeah.
see them like toe out and stuff like that, be like, I could fix that,
Yeah.
Yeah, you do.
It's like when you get
my hands on
part of the
brand
job.
new white Traverse, all of a sudden you see white Traverses all over
Yeah.
the place. You see somebody with a bad back, you're like, I gotta correct that thing.
Well, I'm looking at Jordan right now. I feel like my posture should be better. This whole time with chiropractors in the room, I'm just like slouching.
Yeah, you need to be adjusted.
Yeah.
I don't even use the back of my chair. Look at this. I'm just rock star over here. Sitting straight up.
Work that core.
That's just good back hygiene.
Speaking of
right.
core, do you guys recommend other forms of exercise, if you will, in conjunction with chiropractic care? For example, yoga would be a good fit, right?
Yeah.
Yeah,
Well,
do
we
that.
kind of got stuck there.
Man, a few words. Dr. Tom.
Could you elaborate?
Tom, everybody.
That was
Yeah.
one of
I'm
our
gonna let
best
you
answers.
take it away from there. It's yoga, Pilates, exercises. Anything that's going to stabilize your core. Obviously, we love people being active and staying fit, but people think that you have to go to extremes, and you don't. Stuff you can do in your home all the time, and just getting that core stability lifelong. Would be good for staying out of pain. It's just that you don't have to find one specific thing. There's a multitude of things that you could do. It's find something that you're happy with and you can stick with, and we're happy with it.
Gotcha.
Have you guys had patients that have stuck with you since you first opened, that once a month or whatever?
Yeah, we have
some.
a ton of maintenance patients. So our big thing is,
Maintenance,
yes, you want, unfortunately, most people come to us because they're in pain. But once they're feeling good, they realize, hey, I like feeling good, and it doesn't take too much to stay that way. And we just call it maintenance care. And so we have most of our patients can make it about once every couple months. and just it's preventing small problems from turning into big problems. You know, kind of like going to the dentist for your teeth.
Yeah.
You don't wait till you have cavities and teeth fall out to go in. You just maintain. Same thing. It doesn't take too much, but
Prevention, yeah.
Prevention is the key.
Yep. Not everyone does that, but
Yeah.
some people
Most-
some people are just in pain for so long, and 10 years of pain, and then they came into us for like 3 weeks and like, man, I just feel a lot better. Like, can I keep this going? Or how do we keep this going? And
Sure.
say, well,
Yeah,
once
keep-
you're stable,
keep paying.
if you
Yeah,
can,
cash some checks.
it's just
Snapping
It's
necks.
free.
Sign here.
It's ain't free. But you get them to come in every couple months for an adjustment, and hopefully we've coached them in that time to be good in the meantime with some at home or at work exercises or stretches, and that helps just keep your spine stable so it doesn't slip out of alignment as easily. You just want a little bit of strength around it.
But that's also where the stereotype of people come in and they're like, well, I've heard once you go to the chiropractor, you always have to keep going. Like,
Yeah.
that's a stereotype
Oh, yeah.
we deal with. And I was like, well, I mean, that's true. We want you to, but like, name one other doctor you've ever been to, and they said, don't come back. Like,
Sure.
that's, you can't name one.
Does your optometrist say that?
That'd
Like,
be being
wait
being
till
a
you have
bad doctor.
Wait till you have a huge eye problem. Don't come back for a check next year. Just wait till it's
And
terrible.
you put it into
Then
in there,
come to me.
you put in that perspective, and they're like, oh, yeah, I guess so. You know, it's
that's
one of those
true, I
deals
guess.
where,
You know, we're not forcing anybody.
no, and it's one of those deals where like we're not overdoing it either. Now there are, as with any profession, there's ones that kind of take advantage of it. There's ones that are like, oh, their maintenance is once a week forever. Well, that's not so much for the patient benefit. That's
Yeah.
more for the doctor. We're not that way.
Sure.
So like I said, we go out every couple months and just make sure your spine is doing well, you're staying healthy, muscles are not dysfunctional, and but yeah, if I would say there is some merit to that because I want them to come back and stay healthy. I don't want
Sure.
to see them when they're just broken down and in pain.
Sure. Yeah.
So, but that's where that comes from. You do kind of have to deal with that connotation every once in a while. You just got to educate them.
Makes sense. What would you consider your biggest success story since you guys have been open? Has there been a patient where you're just like, wow, I mean, they just did a complete 180?
I had one a couple years ago. Obviously can't say last name, but first name was Jennifer. But she'd been having migraine headaches ever since she hit puberty. And so she's 30 some years old now. So a lot of years of almost daily migraines, horrible.
Oh, that's brutal.
Debilitating.
Yeah.
You know, had a hard
Yeah.
time. And so I did some adjustments on her, put her through a little treatment phase, and she woke up one morning and the first time, and she couldn't remember how long, no headache.
Wow.
She just she said, she came and told me, she's like, I just broke down in tears. She's like, I couldn't remember the last time I didn't have a debilitating migraine upon waking up. And so I've been treating her on maintenance now for a couple of years and still very, very rarely having a headache or migraine.
Wow, that's
So,
cool.
And just to have that and have her express that to me was pretty
Yeah, you like to see
pretty
that.
profound.
Well, yeah,
pretty
migraines
cool
can be, like you said, debilitating. Like, just can't function.
Yep.
Yeah. Alex's wife deals with migraines from time to time.
Yeah.
Yeah, she's more of a pill popper.
We see that too.
Sometimes. I see that sometimes.
Yeah.
To each their own.
Dark room, pill popping,
Yeah.
cool rag
Yeah.
having.
She's actually gotten better ever since she got pregnant. The headaches kind of went away, which is kind of weird.
Darn
Well, she
thing,
couldn't
right?
drink anymore.
That's it. Pill popper and boozer.
Booze hound.
Yeah, usually you combine those two. That's a good
That's where
night.
you get
Yeah.
the good recipe.
Man, I seem to only get these migraines when I drink the night before. Just
Yeah,
can't
that
put it
makes
together.
sense now. Jordan, any big success stories for you? I mean, on the administrative side, it's probably learning QuickBooks.
I'm not saving lives as much. I did watch a 3-hour QuickBooks tutorial on YouTube last month. It wasn't easy.
Just getting through that 3 hour, man.
It wasn't easy.
Coming out on the other end, I'll tell you
Someone
what.
had to do it. And that YouTube video had 14 other views. Okay, so I'm one of 15.
Now that is a success story.
Hey, not all heroes wear capes. Okay?
That's awesome.
But seriously,
doesn't wear a cape.
do you have some good stories?
Oh gosh, I just had one here recently where I think you see some misdiagnosis in the world sometimes, or especially in the back pain kind of community. You see some misdiagnosis, and I had a person come in and they're like, "Hey, I'm probably going to be having surgery here pretty soon, but I'm scheduled out for a couple months for this sciatica pain I'm having, and I've got a bulging disc I'm like, well, if you're gonna have surgery, what do you want? And they're like, well, I just want to feel better maybe in the next couple months before surgery. It's like, well, let's see what we can do here. And you do some orthopedic examination, you try to figure out what's going on. And I thought, you know what? I'm not sure the disc bulge is part of this, is causing this person's, leg pain, that radiating pain into the leg. I came across more of a glute muscle problem that can cause like a kind of a fake sciatica. It's called piriformis syndrome, and they had a lot of flared up muscle tissue in their glute. So I thought, tell you what, let's just work on this a little bit. I'm not sure that your disc bulge is actually the main problem here. We'll find out, right? Let's try this for a short phase here and for a short treatment plan to see if it works or not. And we kind of cleaned up the joint dysfunction of the low back and pelvis, and then worked on some glute muscles, and their sciatica pain went away, and they didn't have to have surgery, So,
Wow.
and that's just, you see that sometimes where people are having a symptom and then they go in for an MRI and they see, oh, I've got a disc bulge. And you can sometimes kind of automatically assume that is causing their problem, but there's a lot of disc bulges that aren't the problem. There's a lot of people walking around right now that have disc bulges and they don't have any pain at all, So sometimes it's just an incidental finding.
Sure.
They had a pain down the leg and they also had a disc bulge at the same time. So you want to make sure. But yeah, that was a really cool story because they got to get off the surgeon's books there, which was nice. It doesn't always happen, but that was a pretty cool one. I was happy about
the
that.
surgeon's like, damn him.
They probably didn't know.
Yeah.
Guessing they didn't.
They're
didn't
not
know.
in the circle of
Yeah.
trust.
That's right. They're out.
Yeah.
We got about.
Do you guys adjust each other?
Yeah.
Yeah.
If I can get him to. You got to beg for one.
You got to get on a
It's like
schedule.
a Monday morning, I'm like, I tweaked a shoulder, I need adjusted. I'm busy today.
I'm pretty booked,
By maybe Thursday of that week, I can get an adjustment.
No, we do the same thing. Like we just recommend. I get it about once a month. Same thing for him. Sometimes a little bit more, depending if.
Oh, really?
You know,
I
if
would
it-
think it'd be like once a week.
Yeah.
Nah.
Don't really need it, Like
Yeah.
I said, if we stayed pretty healthy, stay
Physical
active.
specimens like us.
When you're built like we are, you don't need it.
The Ryan Reynolds at 75%.
I did used to be
17.
able. I would only go every couple months. I'd have Tom adjust me. But we're past mid-30s now, and you just notice at some point, like we might go a little more often for those adjustments. It doesn't hold quite as long as it used to, unfortunately.
Right.
I always envision myself as a 30-year-old, but as we creep along here, I'm thinking, nope, the body's saying a little bit different.
Yeah.
We got about a minute here. Last questions. One,
got?
future goals of Komp Chiropractic. And two, anything you want to get out to our thousands of listeners.
Future goals. Before COVID hit, we were pretty close to looking. We were actually talking with a commercial realtor about buying our own building, and we probably got pushed back a couple of years on that. But that's probably in the 5-year plan here is to add another doctor, at least one more doctor to our practice, and then probably have our own commercial space if we can, just a little bit bigger space where we can have multiple doctors, and I think that would be pretty cool to do. Quit paying rent, and
Yeah.
just own your own
Awesome.
building in
Yeah.
10 years down
More
the road.
room for activities.
Yeah, you gotta have room for activities. Maybe put in a golf simulator.
Yeah.
We'll see what. Small things.
Yeah.
Small goals like that. But I'd like to see that come down the road.
Yeah, that's awesome.
Tom, anything you want to get
Tom,
into?
yeah.
1,000.
Same thing. I'd like to just continue to expand a little bit on our own building, add a couple doctors underneath us. The more people we can help, the better. But they got to be a good fit for us and treat the way we do, treat the whole body, not just the spine.
Sure.
And that's it. Kind of just grow and I don't know, continue to take care of our clients. And our Nebraska has been amazing. Omaha's been amazing. Like I said, we've been here 10 years, and I couldn't ask for anything better. Great community, great support. Like I said, we came up here with nothing, and it's been an amazing 10 years. So
Yeah, we were born and raised here, so we.
thanks to the Omaha community, they've been very supportive of us. It's been great.
Well, it's been great having you guys
Yeah,
on.
thanks for coming on, guys.
This is another episode of the Brother Side Podcast. Thank you, Dr. Jordan, Dr. Tom. We'll catch you
Thanks,
the
guys.
next time.
Thank you, guys.
Thank you.